Okay, hello. I'm Trina Spencer, and I'm just going to do just a quick little intro to a few things to orient you to the things that are available in the file. I don't know, he called them pods, apparently. I am the research director at the Institute for Human Development, which is a University Center of Excellence on Disabilities for Northern Arizona University. And I've had the privilege of working with the Office of Children with Special Healthcare Needs through Arizona Department of Health Services for the last 3 years. And this webinar is going to be an overview of the products or the things that have resulted from this partnership. In the pod that says Files 2, I believe you can see that screen, there are a number of briefs and elements that you're going to need to look at or that you're going to want to maybe. One of them is a PDF of the slides I'm going to be showing today. So if you want to download those or look at those another time or follow along while you're on the webinar, you may. It's the EBHP webinar slides. That's the one you can download. The other things that have a bunch of acronyms, I'm going to explain what those are, but I'm going to be referring to them in the presentation. So the HPCC is the Health Promotion Curriculum Checklist, and that's the little assessment tool that I'm going to be talking about. The HPCC manual is the manual that goes with it. Then at the very bottom it says AHB, it's Arizona Health Brief, and that's a specific review, and I'll also be calling that out. But there are some content in that particular review that I don't show on the screen, so you might want to look at that yourself. And then the one that says AHH Pathways and AHH Media Smart, those are specific Arizona Health highlights, two programs that we highlighted in briefs. Okay, so you're welcome to download those. Most of them are going to be available on the Ocean website. And I believe I understand that the website is going through some transition, so I'm not exactly sure where that's going to be on the website, but it will be there. Either way, you have them available today. Okay, so in terms of an overview for the presentation, by the way, I should mention that if somebody does have a question, you can just type it into the chat and I'll see that somebody's typing a question and I'll stop and be able to address it, okay? I do have to warn you though, most of this presentation is going to be very informational. I'm going to try to make it quick because you guys are very busy people and I want to go through and just basically introduce to you what we've been doing and point you in the direction to find out more. Because I can't possibly talk about everything in this hour, and you probably don't want to listen for that long. Okay, so we're going to do, this is a brief overview. I'm going to introduce evidence-based practice and then talk about it specifically as it relates to health promotion and the specific health promotion initiative that we've been working on with Ocean. I'm going to give a brief report of the findings from a systematic review of health promotion curricula. And some of those are reported in, the results are reported in the AHB brief. I'm also going to introduce the health briefs and the highlights so that you know what kind of content is in there. And it might be content that's useful to you, or it's content that you would want to then pass on to other people. This is just going to be a good introduction so you know what's in it. And then the very last piece is just introducing the health promotion curriculum checklist and then talking briefly about how you might be able to use it. Okay, evidence-based practice. This is one of my very most favorite topics, and the definition, we'll just start right there. The definition that most people adhere to is one that was proposed in the 90s in year 2000 by the medical profession. And the definition reads, evidence-based practice is a decision-making process that integrates best available evidence, clinical expertise, and professional judgment, and then also individual and family values, preferences, contexts. Okay, just really quickly to point out or reiterate that this is a decision-making process and that it's not evidence-based practice unless all three of those components are included and integrated into that process. The assumption, of course, is programs or interventions, treatments, curricula with strong research support produce the best outcomes. And that's obviously the assumption that we work off of, which is why there's money going into research dollars to make sure that we have good, strong research support for the things that we recommend. for practice. I have a slight caution here because there is a traditional way of talking about evidence-based practice that might distract us from doing it or understanding it properly. And so I give this caution almost always. There's a huge emphasis on the empirical research for evidence-based practice, but it's much more than that. Evidence-based practice, like I said before, is really a decision-making process. And the tradition in the trenches, in our schools, and even in published papers, the conversation is about an evidence-based practice. So a noun. The intervention itself sometimes gets that designation of an evidence-based treatment, an evidence-based curriculum, that kind of thing. But if you remember, the definition is really about a decision-making process. And so the best available evidence is important and it's critical to it, but it has to be integrated with individual and family characteristics, values, preferences, and the context that the intervention or curriculum or program is going to be implemented, as well as the clinical expertise and professional judgment. They are necessary to make sure that there's a good match between that empirically supported program and the individual or group that it's intended for. One of my concerns, and where I have been in a practitioner-oriented profession and now more of a researcher, my concern has always been that if you read an article and a particular intervention or program has been shown to be effective with the population that's in the research article, there is not necessarily a good match between those people in the article and the people that you're trying to use the program with. And that's really up to the professional to make a decision about how to integrate that research study with what I know about my client. And that is the quintessential activity of an evidence-based practitioner and of evidence-based practice. It's about that the integrating component. It is risky to take something off of the shelf, like, oh, this is an empirically supported treatment or a program, and just apply it blanketly because we haven't determined whether it's a good fit for our particular clients or the people we're going to try to use it with. So that's my caution. This particular graphic here illustrates this decision-making process and how all three of those components, the best available evidence, client values and context, and then professional judgment, clinical expertise, how they're really important. I want to point out here that right here are the roles of, let's say, the professional. They've got to select a treatment, and in our case, it's we're talking about Curricula. So we have to select something. It's also the role and responsibility of the professional or the family, or whoever is making that decision. When I say professional, but I really mean the team, and depending on the context, whoever it is who's making these decisions. But the three purposes or roles would be selecting something, adapting it, and then implementing it. Okay? But we start with a practical question, like what's an appropriate health promotion curriculum for this population? Okay, specific population. And we're talking about integrating information about the client values and context right from the get-go, because we wouldn't even be able to form our practical question if there wasn't some of this already. In addition, it's filtered through professional judgment or clinical expertise just to formulate our question that we're trying to get an answer to. Once we have this, and once we have this practical question informed by our client values and filtered through professional judgment, then we can get to best available evidence. This might lead us to search for research that is relevant to the topic that we're, relevant to the question we're trying to answer. And of course, there's some more filtering there because as a professional, we make judgments about what databases to go, what keywords we're going to search for, if we're going to talk to our friend versus go to a journal. All right, there's some professional judgment and clinical expertise that is already getting us here. Okay, then let's say there's a number of articles or a number of resources that point to a set of treatments, or maybe one treatment or one program, and we select it here. And obviously there's some more matching going on right here, and we've selected it. Now there might be some differences, like I mentioned before, differences between the participants in that particular study that don't necessarily match ours, so then we need to adapt it, and we have to use what information we have about the client values and context, what the characteristics are of our participants or our clients, and we also use professional judgment to filter that right here. All right. Then we would also implement it, and then there most definitely will be opportunities for professional judgment and more integration with client values and preferences and characteristics and context. And then obviously we are moving towards positive outcomes. One of the things that's important about this in an evidence-based practice model, if we don't get the outcomes we're expecting, we have to insert back here in some sort of this process. We start this process again. So our next question might be, our next practical question is relevant to this. Like, why aren't we getting the positive outcomes that we're looking for? We might go back to adapting treatment, making modifications, this kind of thing, so that we eventually get the positive outcomes we're looking for. And all the time, of course, there's some monitoring that's going on so that we can tell when positive outcomes are achieved. Now, this model, just to reiterate that this is a sample of how evidence-based practice is about making good decisions and integrating those three things. If we were to include and talk about like an empirically supported curriculum, or if you use evidence-based practice as a noun, we're really just talking about this part right here, and selecting a treatment for this. Whereas evidence-based practice is the whole thing. Okay, this is going to make more sense when I talk about specifics and how that happens. Okay, so the evidence-based practice in health promotion, right? This is how it's related here, is that evidence-based practice is increasingly more important and visible in health services. You know, insurance companies, every type of organization that's designed to promote health has intention and understands, or at least to the point where they hear evidence-based practice. And it's important that the quality and effectiveness of health promotion programs are stronger, because the programs vary right now. There are so many programs available to promote health, but in terms of their effectiveness and their quality, huge disparities among them. We discovered that very quickly when we started out our search for the review. There were so many programs, but very few of them actually had any research to support them. And I'm going to show you the results of some of that in just a minute. But of course, programs with research-based components or empirical validation or empirical validation have the greatest potential for benefit. I'm going to talk more about these two things, so make sure you're understanding this: research-based components and empirical validation. Research-based components means that there are elements of the program that have research support, but by itself or as a whole, that particular program has not been validated or has not been tested in empirical research. However, the empirical validation means that that program as a whole has been tested empirically in research. So you see that you could have a program that has really good components because they have drawn from research. Some people call this research informed. But that's where you get sometimes these terms: research-based program, that the program itself was designed based on past research about the elements and components that are critical for it. However, it might not have been tested in a strong quality research study. But it would be nice if we could have both: design of programs from research-based components, and then after it is designed and put together, then it is empirically validated. That would be the best. So in terms of background for the evidence-based health promotion initiative with the Office of Children with Special Healthcare Needs, this is some of the motivation behind what we're doing. Children and youth with special healthcare needs are at risk for having chronic physical, developmental, behavioral, and emotional conditions, needing health and related services, and developing secondary conditions related to poor health. That one in particular is important. And children with special healthcare needs are less likely to access healthcare services, and specifically preventative care or health education. Oftentimes, most kids are getting access to health education programs through their schools, and oftentimes children with special healthcare needs are not participating. And we know that children with special healthcare needs can benefit from effective health promotion programs, right? So that's our background. All right, so the first thing that we did was review systematically a set of curricula that was designed to promote nutrition and physical activity. And I mentioned earlier, we found many, many curricula, but chose a subset of them to really look at carefully and to analyze for some components that were important for ocean. Okay, the goal of this review was to identify effective, empirically supported health promotion curricula. And this is that empirical validation. We wanted to know how many of these programs and which programs have been empirically validated so that they might show up as a list of potential programs and curricula for people to select. We also knew that not very many had good empirical validation, so our second goal was to help professionals and families make curriculum choices informed by the available evidence, the best evidence that is available. Let me say that again. The best available evidence is about the evidence that is available, not just there's a specific kind of evidence that you can use, all right? Sure, better evidence in terms of the quality of research design is good, but what if that's not available? We need to be able to make choices with whatever evidence is available, and that was our second goal. So if you see here, the tag up here at the top is actually the title for one of those files, the Arizona Health Brief Review. So it was a review of health promotion curricula for children and youth with special health care needs. And the website is given there too for Ocean. This here is the results of that specific review. We reviewed 42 programs that were specifically targeting nutrition and physical activity. This isn't all of them, but this is just a little bit of a snippet, and the quality is not excellent here, so that you should want to open up the other file to see it a little bit better. Some of the things I want to point out is the things that we were looking for were study quality. Okay, once we looked and found all these studies, we were looking at how good was the study itself. We were also looking for intervention effects. Did it have the impact on outcomes that were meaningful? All right, and were they large enough? These two are both, they fall under the best available evidence in terms of evidence-based practice. Okay, this one right here is relevance. And this is related specifically to Ocean because we looked at every single one of these curricula to determine its relevance for children and youth with special health care needs. So programs that scored high in the relevance section were inclusive and appropriate for a variety of children and youth with special health care needs. We wanted it to be, or Ocean was specifically looking for programs that could include all children. And this is part of the values that Ocean has to provide inclusive health promotion opportunities for all kids. Another thing that made programs score high in relevance was the program's potential to prevent secondary conditions. Like some of the information I shared a few minutes ago, that children with special health care needs tend to acquire secondary health conditions as a result of not having healthy lives. And so that was one of the things that they were most interested in. Another aspect of relevance was family involvement. They wanted to see which programs involved the families or involved community in some way. Another one was that the program was suitable for implementation in a variety of home and community settings. Oftentimes, programs were specifically school-based, like it really needed to be embedded in a school, and those would score lower than others. But if the curriculum or the program was able to be implemented anywhere, in a child's home, in a community center, in a health clinic, all those places, then they would score higher in terms of relevance. And the way we've done the results here is kind of in consumer reports. So this one, in terms of study quality, this was a very, very high study quality, pretty good effects, but not perfect, and it was highly relevant. Healthy and Ready to Learn is another one that scored pretty high, and Media Smart Youth also had really high study quality, intervention effects, and highly relevant. Pathways was another one that I want to point out. It had good study quality and it was fairly relevant. The whole list of them can be found in the brief. The other thing I want to point out is, just in case if you're looking for a specific curriculum and it doesn't show up on our list, there's a couple reasons why that would be. One, if it was not specifically targeting nutrition or physical activity. So programs that just targeted physical activity didn't show up on our list, and programs that just did nutrition didn't show up on our list. They had to do both, and did not necessarily have other things that they were targeting. The other reason why they might not show up on our list is if they had 0 empirical research studies. So these were the only ones that had an empirical validation study attempted, okay? Okay, so here's some of the results really briefly. 3 of the curricula had the strongest evidence and relevance, and they were Healthy and Ready to Learn, Media Smart Youth, and Let Us Protect Our Future. What we did after we got these results is attempt to locate them and look more carefully so that we could highlight them in a brief. So the ones in the red were the ones that were available for that purpose. The others were either unavailable, or since the research study, they have morphed into something else, and that does happen. Healthy and Ready to Learn is more a federal health promotion initiative that is actually used through pediatricians, and so it's not exactly a curriculum anymore. The curricula that were considered promising didn't have as high of ratings, but were still quite promising, were Be Smart, Family Fitness Program, and Pathways. And Pathways was one of the programs that we highlighted as well. And of course, these are available in that, I don't know, for download. Okay. All right. The other thing that we did from this review is we extracted what the research-based components were. So one of the ways of doing that is looking at all of the programs that ended up having high ratings and looked at elements that were in common among all of them, and that had previous research that says something like children do better when families are involved, something like that. That was the component that we were looking at. And so these were the components that we extracted from this review. And these will come up multiple times because we use these to inform the next stages of the health promotion, evidence-based health promotion initiative. Okay, so the first one is prevention and promotion of new skills. Inclusive, we kind of talked about that in terms of relevance, that it was inclusive of all kids. Longevity simply means that it is long enough, the intervention is strong enough, and it's targeting lifelong skills. Collaboration involves the families and other community partners. Training would be something like the professional development. And then programs that have progress monitoring and evaluation of the program. These kind of assessment components were strong. And then this last one is the research evidence, which is really the empirical validation component. Now, I'm going to be talking more about these in just a few minutes, but they're a basis for which we did the next thing. So the health promotion curriculum checklist was based on these components. And they were the findings of the systematic review. And the purpose of this was because many of those programs and many of the programs that might be currently implemented may not have an empirical validation study. And in the absence of such strong, high-quality research to support the use of a particular program, another way of looking at the quality or the appropriateness of a program is to look at those actual components that are research-based. So the HPCC is intended to guide the appraisal of current and future health promotion curricula for quality research-based components. And I'm just going to reiterate that a little bit, because what I mean by current is, let's say you're a health professional and you use a program currently, or you have designed one, all right, and you want to evaluate or appraise the quality of it. You can use the health promotion curriculum checklist to determine how good your program is and where the weak points are and if there's any modifications that are necessary. And if you appraise the one that's currently in place and you find it to be low, it's not very high quality, you may want to select a new program, a new curriculum. And in which case then you might order an initial set of a curriculum and then use the health promotion curriculum checklist to determine which of your choices, which of the available programs are best suited for your needs and have the research-based components in there. So it's a tool to help you determine how good your current program is and help you to select a new one if you need to. The review primarily investigated the strength of the evidence for each of the programs. There were 42 programs that we reviewed, but the health promotion curriculum checklist offers a more in-depth examination of the program and its components. And that's also available for download. Okay, so in the checklist there are 26 items or questions, and there's a manual. They're very simple. The questions are like yes, no, like does the program have this or does it not have this? And of course they are organized in the 7 characteristics or the elements of effective health promotion curricula. There are also 2 supplemental materials. One is an affordability table. So once you find curricula, you go through these 26 items, then you can go to this affordability table that kind of walks you through, do we have the resources available to purchase this or to implement this program? The materials checklist just kind of walks you through to determine, is it very video based or internet based, or do you need to have these lesson plans or workbooks? What all are the materials that is involved in this particular program? And then I mentioned this, that the 6 that I have in red here, the 6 components, those are the research-based components. And number 7 is the one that's the empirical validation about the research evidence. I'm just pointing that out. Okay, so now what I'm going to do is I'm just going to walk through these components and just describe them a little bit more in detail. But most of this stuff comes from the manual, and it'll explain what these are about and how to score them. Okay, so prevention and promotion of new skills. Health promotion programs should proactively and positively target the function and context of behaviors. What this means is that we're not relying on reactive or punishing strategies to teach healthy behaviors. We want to look at the context in which the behaviors are happening and thinking about what's the purpose of these behaviors. And really, it's really about promoting appropriate skills that are going to be relevant for a child lifelong. So just making healthy decisions, a bag of Cheetos or an apple, which is a good snack. The environment is important in this particular component as well, because that's why we involve the family or other community partners, so that the entire environment is set up in a way to offer healthy choices. So setting out a bowl of fruit as opposed to the bag of chips, making sure that the environment has those things. And that this point is that the program should be teaching these healthy behaviors from the onset. Okay, inclusion. Health promotion programming must be universally available and accessible to all. So there were some programs that had specific activities that would include children who used wheelchairs, or in a way people who didn't have access to a certain piece of the materials. And that's something. The better programs were inclusive and could be adapted for any situation. It was also apparent that the strong programs promoted valuing cultural diversity and respect for individual worth and community. In terms of longevity, it's somewhat related to the prevention and promotion of healthy skills, but it's important that the skills were relevant to choices long term, so their whole life, not just here and now. But if an individual comes into the program with some bad habits already, it might take some time to see progress and change. So the other component of this is that programs should be in effect long enough to observe progress. So a program that's like 2 weeks long might not have much impact, but a program that is a whole year or more and it was delivered, with fidelity, might have a greater impact on children's habits, healthy eating and activity habits. Collaboration. This one just refers to the connections to the family and other community entities, and those that had collaboration across these other entities seem to be stronger programs. Communication among family, schools, and community partners is essential, and that the children and youth learn how to generalize the skills. So they learn it in this context, but they make good choices once they're outside at in the cafeteria, okay? So that they can generalize and translate them across any context. Another one is training, that people who are going to be implementing the program need to have some training, and that the programs themselves, the ones that were effective, had this kind of built in. Things that would be included in this are maybe some online training modules. Many of the programs had online support or training modules. Most of them had manuals and lesson guides. What I mean by lesson guides is sometimes we might consider it a lesson plan, but some of it might just be an outline of the things that you're supposed to discuss in that particular session. But the more effective programs had very detailed lesson guides so that people weren't just winging it or making it up. They had specific content and pulled in specific materials and examples to be able to teach the content that they were after. Also, programs are only effective if they're implemented in the manner in which they are designed. And this is called fidelity. So implementation fidelity means that the person implementing it is doing it the way the program was designed to be implemented. And if they're changing it too much or changing really important pieces, then the program will have less impact for the children. Now, there's a caveat in there because it is appropriate to modify for certain children, but that the training should point the implementer to the places that are appropriate to modify and which components are not appropriate to modify. Yeah. Okay, so progress monitoring and evaluation. This is the 6th one. Essentially, the effective programs have a means of being able to determine whether their program is effective or not. Sometimes that looks like a little log that the individuals or the participants are collecting on their own healthy behavior and healthy choices, and that somehow you're reviewing those kind of data. It could be another kind of assessment tool that they do weekly, or maybe they do weigh-ins, or they do BMI readings, those kinds of things. Somehow we have to be able to monitor the impact of the program. And effective programs generally have some way to assess it before they start the program, during the program, and after the implementation of the program. We need to know whether the children and youth with special health care needs are attaining the curriculum goals. Okay. And then the last one is research evidence. This part is the empirical validation. In the health promotion curriculum checklist, that last one talks about research evidence, and these are some of the items that are on there. But just as a reminder, the first 6 are the research-based components. They are not necessarily the things that were validated for that particular program, but they come from the effective programs that have research. They are the common elements in health promotion curricula. Okay. In the research evidence, you should have an empirically validated program that has a good, strong study, strong effects. And when you're doing these kind of studies, you're looking to see whether the instruments are valid and reliable. A valid instrument is one that measures what it's supposed to measure. Okay, so BMI or some weight, those tend to be very valid because they're measuring exactly what it's supposed to measure. Things that are like more consumer reports or somebody, a family checklist or a survey, they tend to be less valid, although they could be very valid, and you want to just make sure to check that. Also, reliable means that every time you give that particular assessment, you're getting the same kind of results. So if two people were to give the same assessment, they would get the same result. That would be reliable. Okay, I ran through a lot of information really fast. Um, and maybe that's great. Everybody's got busy schedules. So I want to just open it up for some questions. If there is any, you can just type some in. Or if not, you've got access to all of those files for more information. Okay, doesn't appear that anybody has any questions. I'll stay on for another minute, but if you guys, if you do think of other questions, you can email me or email the IHD. And if you need more information about any of those files that are available for download, please let me know.